Hey anesthesia professionals, guess what's now off patent? It's Sugammadex, one of the most useful medications for reversing an anesthetic. Now that a lot of you may have more access to it soon, here's a quick summary of one of the most recent articles on Sugammadex published by the APSF. Sugammadex is a reversal drug that works by binding Rocuronium and Vecuronium and removing them from circulation. It can reverse most depths of block caused by these two drugs. The usual FDA-approved dosing is 2 mg per kilogram for a moderate block, 4 mg per kilogram for a deep block, and 16 mg per kilogram for immediate reversal after a large intubating dose of Rocuronium. Now let's talk about renal failure. Sugammadex is cleared mainly by the kidneys. In patients with normal kidney function, its half-life is about 2 hours, and more than 90% is excreted in the urine within 24 hours. However, if there's renal disease, the half-life becomes much longer, about 4 hours in mild, 6 hours in moderate, and up to 19 hours in severe renal failure. There is a theoretical risk of recuriorization because the Sugammadex-Rocuronium complex can slowly come apart before the kidneys can filter it, although it's pretty rare. The complex is stable and can be removed with high-flux dialysis. What about kids? Sugammadex is FDA approved for children 2 years and older using the same dosing as adults for moderate and deep block. However, the 16 mg per kilogram immediate reversal dose is not FDA approved in children. Use in children under 2 years old is off-label, and there are no clearly validated dosing guidelines. So what if Rocuronium gets infiltrated in the IV? If it infiltrates into tissue instead of going IV, it can be absorbed sporadically and cause delayed weakness and recuriorization. Sugammadex has been used successfully in these cases, but because it has a short half-life and a 1-to-1 binding ratio, reversal might not always be sustained if more Rocuronium keeps seeping into the bloodstream from the tissue. And finally, anaphylaxis. Sugammadex-related anaphylaxis is rare, but real. Reported reactions usually happen within minutes and often involve the airway and breathing, such as bronchospasm with oxygen desaturation in about half of cases. Because reactions can occur after extubation, patients should be observed closely in the OR for at least 5 minutes after administration.